So, I mean, what lessons would you draw, from middle and lower income countries, such as you find in Central America? I mean, it seems like the Nicaraguan model would be that if you've been investing in public health for 10 or 15 years and have a system which is set up for you, and then you have a community-based system of both healthcare and governance, you may have better outcomes than a top-down model, which has been favoured in many neighbouring countries, but also, of course, during the pandemic around the world.
Yes, and I think just to sort of complete the statistical picture, as it were, that's illustrated by what happened with vaccinations, because Honduras and other northern Central American countries got vaccines very quickly because the US was worried about COVID passing across the border. So Mexico, Honduras, Guatemala, and El Salvador all got donations from the US as soon as they started making donations of vaccines to other countries last year. But Nicaragua had to wait several months more, and it got vaccines through the COVID Shield system, the international system, and then later from Cuba and from Russia. Mm-hmm. But once vaccination started here, it moved very fast because of the community-based system that we talked about and the house-to-house visits. So now well over 90% of the population has had at least one dose. And to have had a complete dose, we have, I think it's 86% of the population have had a complete dose, at least one complete dose. I personally have had 5 vaccine doses.
Yeah.
Yes. And many people have had that number. I'm not unusual.
And this has been largely through the community-based brigades, has it?
Yes, you can go to health centres and hospitals and get a COVID vaccination anytime. But at the start, they had brigades going all over the country, so even remote rural areas were visited. And I've got a nurse friend who travelled literally all over the country to the most remote places, carrying vaccines and dishing them out to people. And so this of course was another factor in success, because it meant that since the vaccination started, there's been hardly any COVID cases. There hasn't been the resurgence that there's been even in countries like the UK, and certainly not like the US. So the level of vaccination now is higher now than in the UK and in the US, and I think internationally it's one of the highest in the world. In Honduras, in contrast, because they don't have the community-based system, they're still only just over 50% of the population with a complete vaccination. And Guatemala is in a similar position. So whereas Costa Rica and Panama have done well on vaccinations as well, the poorer northern Central American countries are still behind.
So with that, that's again this community-based health system, reaping its benefits. And if we also talk about, so we've talked about that, and we've talked about, obviously the schools didn't close, education wasn't impacted. Can we come back to the economic impacts then? Because you said at the start, that one of the reasons the government didn't choose the lockdown model was that because of the community-based policing, it would be hard to enforce, and because of the community and because of the informal economy, it would be impossible for people to continue. And of course, that wasn't followed in other countries. What's been the legacy of that? And how is Nicaragua now coping with, for example, the inflation? Is that as big a problem in Nicaragua as neighbouring countries? What were the socioeconomic impacts of the last 2 years?
It's certainly been considerable because of this problem that we had the earlier economic impact of the coup attempt, and yes. Tourism is quite an important part of the economy, and obviously foreign investment is significant as well. So both of those were hit by the earlier coup attempt, and then 2 years later the pandemic. But the country managed to grow by 20% the economy managed to grow by 20% in 2021. So the recovery was very fast, and in this year the forecast is for 5% growth, which is one of the highest in Latin America. So having collapsed in 2019 to an economic point which was worse than 2017 because of the coup attempt, it's now recovering again, and has I think probably gone past 2017's performance.
And how is that affecting people, the majority of people who, as you say, running small businesses of one kind or another in the informal sector?
It would be impossible to say that there are no problems. And an issue we might want to talk about is the recent upsurge in migration to the US. And also the fact that there's no longer the outlet of migration to the same extent of migration to Costa Rica. So yes, the economy is still in a not a perfect state, and the country needs more investment, and it needs more development, and this has been held back by both the pandemic and the coup attempt. But I think there's a general feeling that things are getting better. For example, it's once again one of the safest countries in Latin America, as it was in 2017. So I think that's very important, both for Nicaraguans and for the prospect of tourists and foreign investment to come back into the country. And certainly we haven't seen the horrendous consequences of the pandemic that occurred in Honduras, where poverty levels have now exceeded 70%. Xiomara Castro in the United Nations, I think it was in February, said that their judgment was that 74% of the Honduran population is living in poverty. And before it was a less poor country than Nicaragua.
I mean, this is one of the very. I mean, I've read reports on this, and the increase in poverty in Latin America since the start of the pandemic has been absolutely shocking, and it's hardly been reported in broader media at all. And that brings me actually to a question I do really want to ask you: is you've got this reality of across the continent, really, of this enormous spike in people who were self-employed doing various things suddenly were unable to work because of the measures that were taken and used up all their savings, haven't really been able to start again, and quite apart from the gendered impacts, which have been colossal on women's reproductive rights and so forth. But yet on the other hand, the global media, as you say, the Washington Post is covering a municipal election in Nicaragua. There's not a single other country on earth that it would cover a municipal election for. And you have this general portrayal of the country as a dictatorship, as, having taken all the wrong choices. I mean, how do you feel about that? Living as you do in what you describe, in one of the safest countries in the hemisphere.
It's extremely frustrating, and in fact, this is what's motivated me to write a lot about Nicaragua, because I just think it's, you ought to look at a country fairly, looking at its bad points as well as its good points, but to completely ignore the achievements. I mean, what other country, especially a poor one, has built 24 public sector hospitals in only 15 years? And they're not bad hospitals. I mean, I've been to 2 of them. And they're really good quality hospitals. I mean, the National Health Service in the UK would be proud to have them. It's just absurd to ignore that social achievement. Whatever you think about the sort of high-level politics going on, the media, and of course the US and European Union, UK governments ignore what's happening at local level, which is that there's been this tremendous investment in all kinds of public services. And perhaps it comes back to this point that was made during the 1980s when Oxfam issued a report about Nicaragua saying the threat of a good example. And I think that very much applies again. The idea that a poor country can build 24 spanking new excellent hospitals and do, for example, for the first time, intrafetal operations and use new life-saving techniques that are currently available in advanced countries. This is a kind of threat rather than something that should be of great interest.
Well, I think let's try and change that strapline to not the dangers of a good example, but the possibilities of a good example. The potential of a good example. Yes. I think it seems it's almost like Nicaragua has become the Cuba of the 2020s. Nobody wants to talk about the healthcare system because it doesn't fit into a broader picture. Well,
it's true, but I think in the case of Cuba, at least on the left, certainly in Europe and really in the States as well, I suppose, there is this tremendous acknowledgement of the success of Cuba's health system. And there was acknowledgement, for example, in newspapers like The Guardian, of the success of Cuba in getting vaccinations out and producing its own vaccines. But there's never been any acknowledgement of that success in Nicaragua. It's a smaller country, and perhaps, many on the left have taken the sort of accepted line that it's a dictatorship. And so it's kind of ignored.
Well, let's hope that this podcast will get enough views for people to change their minds on that a little bit. John, that's been great. Thank you so much. Usually I'm afraid these podcasts for listeners have been pretty depressing because we've talked to people around the world in many countries who've not had such a positive experience as Nicaragua appears to have had. But so I'm glad that we've managed to address that a little bit, although, of course, what you told us about Honduras was very chastening too. But thanks very much for participating. It's been great to chat about this.
You're welcome. It's been good to talk.